Hi, I'm Heather Davis, Board Chair for National Registry of EMTs.
Hi, and I'm Matt Zavatsky, the President of the National Association of EMTs. And NAEMT and the National Registry are happy to present the 2020 Rocco V. Morando Award to Dr. Doug Kupas.
For Dr. Kupas, like Rocco Morando, there's no such thing as status quo. You're either getting better or you're getting worse. And for both of these gentlemen, they are about using their gifts of wisdom, innovation, and caring about people to make EMS better for both patients and providers. Rocco was the first executive director for the National Registry and was instrumental in certifying the first set of EMTs and paramedics. He also was instrumental in establishing the recertification requirements and the national standard curriculums for both EMTs and paramedics. And one other really important mission that Rocco had was to establish the first professional organization, which is the NAEMT. And so that is one of the reasons that NAEMT and National Registry have such a close professional relationship. Our future is bright when we work together, and that's what this award is about.
Exactly, Heather. And 2020 is an important year for Dr. Kupas's career. It holds many milestones. This year marks 40 years in EMS after beginning his career with the Lower Kieske Ambulance as a volunteer at the age of 16. And this started after his Cub Scout troop got a tour of that service, and he and his brother were inspired to get involved. Dr. Kupas is an EMS physician's EMS physician. He's a flight physician, an EMS medical director for multiple EMS agencies, and he has been the Commonwealth EMS medical director for the state of Pennsylvania for the past 20 years. During this time, he developed the anonymous patient safety event reporting system that later became the NAEMT event system.
I don't know if you're keeping track there, but there's a 40 years in EMS, 30 years as a physician, and 20 years as the Pennsylvania medical director. So this is a really important year for him. So he has been and continues to be an avid researcher and passionate advocate for the EMS provider and for patient safety as well. Multiple publications, including NHTSA's white paper monograph, in 2017 on the use of lights and sirens in EMS.
Dr. Kupas's other professional passions include the CARES Oversight and Advisory Board member, that's the Cardiac Arrest Registry and Reporting System. And he's a partner in the Heart Rescue Project. He does a ton of research in CPR quality and field termination. One of my early experiences with Dr. Kupas was I had the blessing to go speak at a conference in northern Pennsylvania. And I remember walking past one of the meeting rooms and seeing all of these EMTs and paramedics literally on the floor in the room with mannequins and AEDs and monitors, and they were practicing what Dr. Kupas literally was on the floor teaching them on effective and quality CPR, but also being able to break the news to family members about a potential termination of that resuscitation. So when I think back on it and I saw that scene, it was almost, Heather, like a biblical event, sort of seeing Dr. Kupas with all of the people around him just literally soaking up all of this information.
I can't imagine what that looked like, but it's such an important skill, and I know it's really important to him to teach providers how to do that. Dr. Kupas is a board member for NAEMSP. He's a member of NASEMSO's Medical Directors Council. He's a board member for Pennsylvania Trauma Systems Foundation and a member of ABEM's EMS Subspecialty Certification Board as well. Many, many involvement at the professional level.
And apparently you can count on Dr. Kupas to get things done. You know, when we were thinking about giving Dr. Kupas this award, we had to do a rather extensive background check, and we found out some very interesting things from various people from his past, which we can't really, decorum prevents us from doing that right now. But I did have the opportunity to speak with Dr. David Tan, who is the president of the National Association of EMS Physicians, and he said, you know, Dr. Kupas is just one of those guys who gets things done. And I know that if Dr. Kupas is leading something or if he's involved in it, he'll end up leading it and stuff just gets done. So I never worry about projects getting done when Dr. Kupas is assigned to the project. So for all the reasons that you heard Heather and I talk about, and probably the thousands that we don't have time to talk about now, we are thrilled to present Dr. Kupas with this year's Rocco V. Morando Award. And we'll allow Dr. Kupas some moment here with us. Doug, go right ahead, sir.
Well, thank you, Matt, Heather, NAEMT, and the National Registry. I'm really overwhelmingly honored to have been selected for the Rocco Morando Award. I reviewed the list of recipients with great humility, and I'm humbled to be considered among their ranks. My accomplishments are really all because of the people who mentored me in the field of EMS and the innovative agencies that have allowed me to share in their experiences. As you said, at the age of 16, I started as a volunteer with Lower Kiski Ambulance Service as an ambulance attendant in Leechburg, Pennsylvania. And there I found a second family among EMS providers. I learned from some of the first EMTs and paramedics in the state, and I learned from Dr. Fraley, the town physician who families often called to do a house call before he decided if they needed an ambulance. As a college student and paramedic, I worked at Citizens Ambulance Service in Indiana, Pennsylvania. This agency was decades ahead of the country in their EMD and their culture of safety. And it is with Citizens that I developed my passion for patient and provider safety. I thank all of my colleagues at Geisinger Health System who have supported EMS, and I thank the Commonwealth of Pennsylvania Department of Health and all the EMS providers in Pennsylvania. Applying science, teamwork, and quality improvement techniques has improved outcomes for our patients. We are at our best when every decision is focused on our patients, and I think that's what I have always tried to do. We're at a very exciting tipping point in EMS. Our country has a great need to integrate patient care at home with the traditional healthcare system. As we tip from traditional EMS reimbursement based on transport to a new reimbursement system that recognizes the value that we bring in patient assessment, care at home, telehealth, and others, EMS brings a unique skill and can be a key component of the broader healthcare system. True integration with the healthcare system will lead to better access for our patients and coordination of their care, and a bright future for EMS. After all, we never stop doing house calls. I want to thank all of the EMS professionals who have been partners, friends, leaders, followers, providers, and innovators with me as we try to improve our EMS systems. Also, I truly am honored to be one of thousands of EMS physicians who have made EMS their practice of medicine. Thank you very much for this award and for the friendships and for allowing me to help our patients through all of you.
Thank you, Dr. Kupas. I think it's very appropriate that you're there in front of one of your ambulances, and truly congratulations. Heather, we'll leave it for you for any closing comments.
Congratulations. We're honored to have you as the next recipient of the Rocco Morando Award. Congratulations again.
Thank you.